Hello, DJ. Hello, DJ. Good to see you.
Thank you, sir. Good
So
to
I'm
see
happy
you
for
too.
you. I'm happy for you.
Thank you.
So, so
Thank
um,
you.
in the next, so I have 9 months to prepare for sooner, right? That's what they call it in Hausa.
Yes,
Sooner. Yeah.
yes, yes,
So I have 9 months to prepare for sooner.
yes.
We're gonna be there.
Mm.
You're in Abuja. I'm gonna be there.
Okay. By God grace.
I'm going to be there. We'll walk the journey together. Chef Tasha, thank you. Thank you, Chef Tasha.
Okay. We can't wait to see you there.
Yeah, so we'll walk the journey together until you get to that point, right? Congratulations. I'm happy for
Yes.
you.
Thank you.
Ola,
Thank you. Hey, is my
Ola, where are
husband.
you?
Yeah, yeah.
She's talking about you.
Good evening. She has
Hello.
been saying good things. Good evening. I'm her husband.
Wonderful. Good to hear you.
Yeah, yes, she has been saying good things about you that you've been helpful to her. So she now said I should speak to you. Thank you very much.
Thank you very
Anytime she
much.
asks you about things, you give her good information. I'm happy. You know, one
Thank
thing,
you.
anytime she's happy,
Yes, we don't.
yes, we've been 2 years without
Oh, really?
pregnancy because we've been
Are
married
you
for 2 years.
serious?
Yes, we've been
Wonderful.
married for 2 years. So and she has been worried, every day worried, like she has
Wonderful.
been following you. Every time she has a question, she talked to Dr. Godwin and we give her advice and other things.
Oh
So yeah,
boy.
I'm just coming back from work now. Unfortunately, I'm not far online. So I'm very happy. I really appreciate.
Oh
May
boy.
the Almighty God continue to bless you and
Amen.
give you your heart desire. Thank you very
Amen.
much, sir. I
Amen.
appreciate it.
Amen.
I appreciate it.
Thank you.
Thank you,
I,
sir.
I, I was
Yes.
telling your wife that by
Yeah.
9 months I'm going to be in your
Yeah.
house for this sooner, right?
Thank you, sir. Thank you, sir. We'll definitely welcome you. For what this is a journey, this is a journey of 1,000 miles that begins with you. A journey
We,
of a
we,
thousand miles that begins with you. So we wait for the end journey by God's grace. After 9 months,
thank you.
I'll ask her to DM you so that we'll get your number and everything, sir. Thank you, doctor.
Thank you.
Thank you very
Thank
much. We
you.
really appreciate. Yes. Thank you.
Thank you. I appreciate you. Thank you very
Thank you.
much.
Thank
Thank
you, sir.
you, DJ. Congratulations.
Mhm.
Congratulations.
Thank you.
No
Thank
better
you, sir.
information can we have than this. That's what we want,
Yes.
right? That's what we
Yes.
want. Everybody
Yes.
who starts a family should have children. That's what we want,
That's why I told you.
right?
Mm.
Yeah. Is that Chrissy? Chrissy, Chrissy, please come up. I want to tell you something. Chrissy, come up. Chrissy, we're about to start our discussion tonight. We are 10K likes. All right, so somebody asked the question 2 weeks ago, and I said I thought I should start from here, right? She was asking about pregnancy glow because her doctor mentioned pregnancy glow, right? I just gave her the abridged version. I usually don't like giving people half knowledge, right? So if you're asking something that is very bogus, I would keep it for a time we will have to deal with it extensively. Why? Because when you have details, you become better. All right. So the pregnancy glow, aka embryo glow, is not something big. It's just um uh pregnancy emotions and physical changes that happens when a woman becomes pregnant. So basically, that is it in a nutshell. Thank you very much for the thank you for the heart me. Thank you for the heart me. If you've not dropped a heart me, this is the time. Two more heart me's, and we will achieve that goal. The two more heart me's, right? So when people say embryo glow or pregnancy glow, they are not talking about a real light that is shining for from from the baby. That's not what they're talking about. Yeah, that's not. Excuse me. That's not what they're talking about. It's um, it's more of emotional, physical changes that happens. It's actually more popular with the with today's people, right? It's popular with modern day people. It's one of those expressions that they use to describe that changes in the woman's body, basically, right? The woman's appearance in her early pregnancy. And I was amazed just a few years ago. I was told that some women deliberately would conceive and abort it in the first trimester just because they want to achieve that pregnancy glow. I was shocked. Really? You'll be amazed what people will do for beauty. That's ridiculous, right? Okay, I'll bring you up. Right? So you'll be amazed what people do because they want this embryo or pregnancy glow. Right? So basically is that change in a woman's body and appearance that happens in the early pregnancy. Sometimes this happens even before pregnancy is confirmed on tests, right? And those beauty funny people are now taking advantage of it, right? So in the simplest possible language, embryo or pregnancy glow is that a visible or invisible sign that shows that a new life is beginning inside your body. For example, for those of us in Nigeria, especially those in the north, when you have an Ameria, after a while there is a way she begins to look. Say, wow, this Amira is shining. Amira means new wife anyway. This Amira is shining. Why? It's the pregnancy glow. And I think some part of it happens in every part of the world, so long as you are pregnant. But it's more specific for those that are new wives, right? New wives is very obvious for them, right? But again, I said all that to say that this pregnancy glow is just a mixture of biology. It's a mixture of biology, hormones, blood flow, even the woman's imagination. The day you tested positive, all manner of good imaginations start flowing through your mind. You know that positive feeling, that positive vibe, right? You've already started envisaging, is it blue pajamas you're going to buy or pink pajamas for the baby and all that. So all the imagination, emotions, blood flow that happens in you, the hormones, all the biology put together is what is bringing about this embryo or pregnancy glow we are talking about. So let's peel the layers one after the other. Who's ready for this gist? If you're ready, as usual, make comments in the comment section. Ready, so that we'll know you are there, right? So let's start with what causes this so-called glow. What causes it, right? What causes this so-called glow? I'm not used to giving half information. If I will tell you something, I will give you the details because because I don't want you to go and quote me wrongly, right? Because I heard one time somebody quoted me wrongly in one of my live stream, and the person came late, and I was amazed, right? So grab your pen and paper, and let's do justice. So, what causes this so-called glow? And you begin to understand why some of these beauty people are trying to take advantage of it. But I disagree with that kind of behavior. It's not right. It's not right. You cannot abort a child because you want to enhance your beauty. That is ridiculous. And like I always say, thunder go fire anybody where commit abortion. All right. So right after conception and implantation, the body switches into a specific kind of mode, a special kind of mode. And in that mode that the body has switched into, there are three hormones that is at play in this new mode, right? From if you were not pregnant, the moment you get pregnant, three hormones become chief, which brings you that glow. Have we stopped tapping? Please tap on your screen, right? Tap on your screen. If not for anything, tap on my forehead. That this coconut head, break it so that the water of knowledge will come outside, right? So, so if not for anything, just tap this coconut head, let it break so that the water will come outside. So, like I was saying, right after conception and implantation, the body enters a special mode. The body enters a special mode. And this special mode, there are three major hormones that begins to rise. Excuse me. All right? We've talked about them a lot before, but I'm going to say it here again. Pregnancy hormone, that is HCG. Pregnancy hormone begins to rise. Remember what happens after implantation? HCG begins to be produced by the fetus, which first will appear in the blood before it appears in the urine. Remember all that gist? That's what we did 2 weeks ago, right? Then progesterone also begins to rise. Remember the nickname we gave progesterone. We call progesterone the protector hormone. 11 people in the FYP, I see you. You want to jump in? And let's tap on the screen so that more people get to see us. Is that Dr. Jody? Jody is here. All right. So progesterone is otherwise known as pregnancy protector. Pregnancy protector. Right? Very important hormone. It's necessary for implantation. It is what gives the uterus the impetus to become thickened, fertile, rich for implantation to take place. Progesterone. And that is why, of course, when you suffer threatened miscarriage, what does your doctor give you? That injection, what do they give you? I'm talking about people who are already pregnant, who have been pregnant. Can you remember what they give you? Thank you, Dr. Jody. Remember what they give you? Progesterone. Why? Because, hey, Mr. Tabs is here. Progesterone. Why? Because progesterone is pregnancy protector. The absence of it will either lead to no implantation, or good evening, welcome, or failed early pregnancy. Progesterone, very important to know. And besides the what it does to the wall of the uterus, besides that, it also instructs the immune system. Thank you, Ecom. Thank you. It also instructs the immune system. Remember what happens in the uterine cavity. Remember, I told you when sperm find their way to the uterine cavity, the immune system of the woman attacks the sperm, attacks it, right? So for those that succeeded and eventually gets to fertilize the egg, now the egg is forming a baby. This embryo will still have to go back there where that immune system will still attack it, right? The dilemma of early pregnancy. So progesterone instructs the immune system to calm down, calm down. No be everything that they attack, right? So that's what happens. Um, that's what happens. Please, Chrissy, moderators, bring everybody that wants to come up, provided they don't make noise. If they make noise, take them down. Everybody that wants to come up. You- For this December, we'll allow everybody to come up. Everybody. But it will be smart for you to engage. It will be smart to engage when you come up. Right? So, like I was saying, the progesterone will instruct the immune system. Say, hey, this is a baby. We've been looking for this baby. Not be everything that they attack. So it will calm down the immune system so that implantation will occur. Then voila, pregnancy. We're carrying our baby. Oh my God. Right? So you can see the miracle that is going on inside the body. So that's progesterone, protector hormone. Right? Then the third hormone is estrogen. Remember estrogen? Estrogen is actually um, uh, responsible for many things. Yeah, it's responsible for many things. Estrogen is actually what makes you a woman in the first place. You see all those womanly behavior is actually estrogen that's causing it, right? So, like I would, yab some of my colleagues when they start doing those their feminine thing. I say, see, estrogen is too much estrogen. If you do shakara, it's estrogen. If you are too choosy, it's estrogen. You know, if you find too much, it's estrogen. Right? So the another name for estrogen. Okay, I'll come back to that question. Hi, Christy Label is here. Yeah, I miss you too. I miss you too. I was away for 1 week, but I'm back, better and stronger. So another name for estrogen is beauty and growth hormone. Estrogen is what makes you look that beautiful, and it's also what helps your baby to grow. It helps the uterine wall also. So estrogen does a lot of things. Yes, yes, I am. Yes, it's just that my voice is sounding different. Somehow I like the way it sounds, but I cannot shout. I wish, that baritone, masculine texture of my voice. I'm not hearing it. but I will get it back. So the next time when Chrissy say go and rest, I will go and rest. I will not do man thing. So these three hormones I just mentioned, the HCG, good to see you. AI big sister is here. 11 people in the FYP, I see you. Right? So these three hormones I mentioned, the HCG, the progesterone, and the estrogen, this is what they do. This is what they do. Number one, they increase the blood flow to the skin. You now begin to see why some people look beautiful, right? All right, thank you, thank you, thank you. I may not remember, so you want to DM me, right? So these hormones, what they do is they increase blood flow to the skin, right? They make the face look slightly fuller and smoother. I'm sure, I'm sure that people like Ola will be looking this way now. These things I'm just saying. Just go and look at your mirror. You will start noticing these things. You see, you have increased blood flow to the skin. The face looks slightly fuller and smoother. There is increased natural skin oil. Stop, stop using those chemicals on your skin that destroys it. Especially those of you that are bleaching. What's wrong with you? Who told you that this is not beautiful? Once you look like this, I don't understand you people, right? Anyway, so the I was saying that these hormones increase the natural skin oil, right? It gives warm, fresh look to the face. So if you see all those people that are in their first trimester looking all beautiful, looking all wonderful, this is the reason, right? This is the reason. For some people, their lips looks pink. Is that not wonderful? Some people that their lips looks pinker, yeah, while others may look their eyes may look brighter eyes. Then for some, there's improved scalp circulation, right? That makes the hair looks more lush, dark, and better texture, right? So these are all the things that these wonderful hormones will do. That's what's bringing about the glow, the glow we're talking about, right? That's why you hear some people say something like, "Your face is shining. Are you pregnant?" In Africa, we need to answer that kind of question, right? Because we always think that when somebody is deliberately asking you about your pregnancy status, they don't become winch wey wan chop your pikin from your belle. Anyway, all that put together is what embryo glow or pregnancy glow is. Is that okay? If you understood anything up to this point, make comments in the comment section. Understand or understood, whatever English it is, just say understood. So we will move on to the next thing, right? Are we ready to go to the next thing? Hey, MSEG is here. MSEG, good to see you. I understand that it's Christmas season, so I will say Feliz Navidad to everybody. Right? All right, let's continue. So let's go to the next one. The next question we need to answer is that Emda? Emda is here. No, 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 no. These are times we're not going to silent the night. We will not silent the night. Right? For many years we've been silencing the night, but we will not silent the night anymore. We have to make the night loud. Good evening, Emda. Please don't forget to tap on your screen. While you are learning, tap on your screen, share the live so that others can also come and join. Because if you don't tap on your screen, more people will not come and learn. So we need people to learn, right? Okay, so where was I? Okay, let's answer the question. When does pregnancy glow start? Or when does embryo glow start? All right. Strictly biology. Biologically, it can start as early as the 8th to 10th day after your ovulation or fertilization, right? So if you know your ovulation and eventually you become pregnant, 8 to 10 days after that ovulation, your glow begins. Why? Because these hormones begin to rise, right? Then it is even more noticeable by the 4th to 6th week of pregnancy. Fearless say, I am pregnant, but I'm having weight gain. What should I do? Nothing. Nothing. After you deliver, you can now go and worry about what you want to do with your weight. Or is it this baby you want to carry and be going for a gym? Even though I know some people do that, right? You're having weight gain. It's just a response to pregnancy hormone. More likely, the weight will begin to shed as you go, as the pregnancy progresses. So don't, something should not even worry you. The health of your baby is more important than anything else. MSEC is level 21. Wonderful. Level 21. Thank you for your commitment, for your support. Thank you. Right? So it's more noticeable on the week 4 to week 6 of pregnancy. Right? Please don't forget to tap on your screen. Thank you very much. Zainab is here. Zainab, are you here? Say hello. Say hello. And you need to explain to me, why did you run away? Why did you abandon me? Right? Talk to me. Right? Then the other thing it does is the pregnancy glow becomes even stronger in the first and in the second trimester. So for those who have been pregnant, you know what I'm talking about. But there is a myth. Some people say, I've heard this over the years. Some will say, oh, when I was pregnant for my boy, I was looking very beautiful. Some others, the same people will say, when I was pregnant for my girl, I was looking so ugly. Others will say, when I was pregnant for my girl, I was looking beautiful. When I was pregnant for my boy, I was looking ugly. Different strokes, different folks. It is not a norm, because some people have taken it that because somebody else looks beautiful and they had a boy, Therefore, anytime a woman is pregnant with a boy, she will look ugly. It's not true. It's not true. The changes you see is due to hormones. And every woman responds to pregnancy hormone differently. It's not the same for everybody. It's not the same for everybody. All right. So some women glow. Some women will even break out with a lot of pimples. Right? You see pimples full everywhere. Some become dull. Some others will feel tired. That's pregnancy for you. Right? But again, this pregnancy glow depends on um 16th. Hello, who is this? Gallant Beauty. Hi, good to see you.
Good
Are you
evening,
following
sir.
me yet? Good evening.
I just followed.
All right, you're welcome. So mute your mic. Let's continue our gist.
Okay.
All right, so this glow we're talking about depends on these six things I'm going to mention. Depends on these six things. Genetics. Genetics that is about your chromosome, hereditary, right? Hereditary. Genetics depends on your skin type. It will also depend on hydration. Some people leave themselves to be dehydrated. You've got to take water. Don't worry, I'll talk about that much later, right? Um, some others, iron level. I'll still talk about that later. Depends on sleep also. I've talked about sleep a lot. It's time to take that sleep seriously, right? Then hormonal balance. These are the things that will determine the glow, whether your own glow is shining out or is dulling in, right? So it depends on any of this. But I want to advise you, right? Embryo glow is not seen on ultrasound. Don't go and be disturbing your doctor for nonsense, right? It's not seen on ultrasound. Embryo glow is not a true medical or ultrasound term that you worry yourself. Oh, doctor, they say I have embryo glow or pregnancy glow, or can you see it now that I'm pregnant? No, it's not a it's not a medical thing that you should worry yourself about, right? So because your doctor will not determine that for you, it's all about your state of health, state of mind, hormones, and the biology at play. Is that okay? So what really you should be concerned about is the health of your baby. Is that okay? So if that is okay, just type on the comment section understood. Let's go to the next important thing. But again, some women also experience a glow-like appearance during their ovulation. And when I was talking about ovulation and menstrual cycle, I mentioned this, that during ovulation, women look finer, more cheeky, and they are even as clingy. Of course, it's ovulation. That's what ovulation will do to you, right? So, so you can also have glow during your ovulation. Some women, not all women anyway, can have that glow. So you don't want to confuse it with the pregnancy glow, right? But regardless, it is glow, right? You actually in ovulation, you actually need that glow. Because how would I find you attractive if you are not glowing? See how God did it. God did it that That time that you are supposed to be ovulating, you're supposed to be shining so that when we see you, we are attracted. And anyway, for some people you don't need to be attracted. They are clingy enough. So that clinginess is enough to get the job done. Right? So biology is key. Biology is key. Some others will have glow when they maybe after sexual activity. you know, you know, oh boy. If you are in Africa, maybe in Nigeria specifically, and you've lived in the ghetto before, there is this joke that they usually give. They say, when you hear a woman, when you hear a woman in the compound singing songs of praise in the morning, just know that her night was good. Her night was good. So that is a type of glow that you should be looking for. Oh boy. Oh boy. Anyway, after sexual activity, some women glow. They have that glow. Just this woman, they don't do you well, right? Right. Some others will have maybe in their luteal phase, they glow, right? And so on and so forth. That's just the things I want to say about this glow thing, so that you do not mistake it for anything else. So is that okay? Can we move on to the tips? I want to give us some tips on how to support early pregnancy naturally, right? Just some tips how to support early pregnancy naturally, the natural way for healthy early pregnancy. Like I always say, I will tell you the whole details, the whole story in details. Good evening. Good evening. Ogochukwu is here. Loisa, how are you? Good to see you. Long time. All right. Tips on how to support early pregnancy naturally. So we're going to look at the details, no half measures. So you know that in early pregnancy is actually a very, very delicate and important stage. It's the delicate and it's also the important stage, right? Many people don't realize that the first 12 weeks of pregnancy, that's the first trimester, right? The first 12 weeks, when the baby's organs begin to form, the baby's brain begin to form, the heart begins to form, the spine begins to form. If this is when those formations start, that should tell you that anything that you don't do right will affect that formation. So you have to be pregnancy smart, because people do a lot of things when they are in their first trimester pregnancy. You begin to wonder, don't they know? Sometimes when they even have some issues, maybe when the baby has come and there is some issues with the baby, they're now asking me questions. Doctor, how come? How could I know? Did you adhere? Were you informed properly? Anyway, that's why you're here tonight. That's why you're here tonight. Please, let's share this live. Let's share it. I don't want people to miss this particular information. I don't want people to miss this. It's too important to miss. Right? It's too important. Okay. So I was saying that this is when the formation happens. And at the same time, the the mother's body is also still learning how to support and protect this new life. Who is asking about PID? Introduce yourself. Who are you? Mutanu Beth. Where are you coming from? Why are you coming by now? All right, I'll answer your question, but calm down. Akua. Well, let's do the knowledge part, then the miracle part will come. All right, is that okay? I believe in miracles, but miracle will not be effective if you don't have knowledge. If you don't have knowledge. So let's do the knowledge part, then we'll believe God for the miracle part. Is that okay? All right. So let's do this. If you are coming up, make sure you mute your mic. Everybody can come up. Everybody can come up. Come up, mute your mic. Is that okay? Good. All right. So where was I? So I said, while this early pregnancy formation is happening, the mother's body also is also still learning how to protect this baby, how to remember what you said about the immune system. So some of these things happen, plus the protection that needs to happen. So this new life must be protected. Yeah. So let's get into the gist. This is the period where, in this period, it's like when you have a garden, you are planting a seed, right? You're planting a seed. Early pregnancy stage is like that period in your garden when you just planted the seed. Loisa, 7 p.m. Nigerian time, Monday to Friday, right? And I've not been around for 1 week now, but moving on, I'll be around. Monday to Friday, Nigerian time, 7 p.m., right? So, like I was saying, so pregnancy is like your garden where you sow the seed. So, if the soil of your garden is good, the seed will grow well, right? If the uterus and every other factor necessary for the pregnancy is good, the baby will grow well. The same way, if the soil is stressed, if the soil is dry, if the soil is poisoned, growth becomes difficult. Is it possible for the environment on which your pregnancy will be sustained to be abnormal? Yes, we've talked about it. We talked about the hormones and all this. But tonight, let's focus on the tips on how to have a healthy early pregnancy, how to support it naturally, right? Okay, so the first thing we should start talking about is what is happening in the body during early pregnancy. Who is ready for this gist? Well, if you're ready, you should be tapping on your screen because that is it helps us to communicate with more people, right? There are lots of people in the FYP, they just want to remain there, but it's okay. I see all of you. So the more we tap, the more people who get to hear this information. That's why, not just for me, but for everybody, right? All right, so let's talk about what is happening in the body during early pregnancy. It's a wonderful experience, right? It is. It is. It is. From we're going to look at from week 1. Anyway, early pregnancy is week 1 to week 12. That is first trimester. That's first trimester, right? So from week 1 to week 12, these are the things that happens, right? The embryo is formed, right? The embryo is um, is formed, or rather, is forming because several other things are also being formed. The embryo is forming the brain, the spinal cord. These are like the first set of things that are formed, right? Then the heartbeat begins. In fact, the very proof of a viable pregnancy is heartbeat. If there is a fetus without a heartbeat, that's not a viable pregnancy. Remember when we last month we talked about early pregnancy failure, and we discussed the different types of early pregnancy failure, the different types of miscarriages, right? So the proof that your pregnancy is viable is heartbeat, right? And you begin to see that from it starts from 5 weeks, but more clearer 6 weeks and above. The moment that is confirmed, you have a viable pregnancy. Is that okay? Then the next set of things that begins to come, the placenta begins to develop. Before the placenta develops, 10 people in the FYP, I see you. Before the placenta develops, what happens is that the fetus, the embryo, needs to be nourished. And where does nourishment come from? It comes from the yolk sac. That nourishment comes from the yolk sac. Another thing that the yolk sac does, hi, Dolapo, mute your mic, please. Another thing that the yolk sac does, it is the first place where blood cells are
Switch it
produced.
off.
So the first set of blood cells are produced are produced in the from the yolk sac. Please, after this live stream, go to my hi sweet me. Go to my page. I've done a lot of videos on early pregnancy, including early pregnancy failure. Go there, go and learn 1 minute each. Go and learn so much. So besides the live stream, there's so much for you to learn in all those videos, right? So go and learn. So the placenta will take over business from the yolk sac, because as the fetus continue to grow and the yolk sac continue to do its job, it continues to shrink, diminish until it disappears. So as it is finishing its job, the placenta by that time becomes established and take over the business of protection, nourishment from the yolk sac. Is that clear up to this point? Hi, sweet me, I see you. Up to this point, is it clear? If you're just joining, please make sure you're tapping on your screen, you're sharing the live, because there are people who needs to hear this information on TikTok right now, but they need to see us because you're tapping. So you want to tap on your screen. So this is what is happening in the first 12 weeks of pregnancy. The brain is formed. The spinal cord is formed. Heartbeat is established because the heart is formed, then heartbeat is established. Placenta is developing, right? Major organs are forming. Major organs like what? The lungs, the liver, the kidneys, they begin to form, right? Then hormones sharply rise, sharply, right? The immune system that we talked about earlier definitely will adjust. It will adjust. So now it's okay. I have accepted this pregnancy. I will not attack it. We are together. Then pregnancy continues. Is that okay? This means if all these things will happen in the first trimester, the first 12 weeks of pregnancy, what does it mean? It means that the body needs more nutrients. The body needs more rest, more water, that is hydration, more hydration, less stress, less stress, less toxin, right? And of course, your hormones have to be balanced. You can see the things that are being formed in the first trimester. Because of that formation, the body needs all this. Is there going to be a development without nutrition? Where will the building blocks come from? Where will the support comes from? Right? Now, let's begin to talk about the power of nutrition in early pregnancy. You don't want to play with that. You don't want to play with nutrition in early pregnancy. Right? So all of the things that the body needs, we'll talk about them and expose you to why you should take them seriously. Right? Why you should take them seriously. So let's talk about the power of nutrition in early pregnancy. Remember that the fetus does not eat food directly. So your rice, beans, yams does not go into the mouth of this fetus, of this baby. It doesn't. Oh boy. Because it doesn't eat directly, it has to feed from the mother's blood supply. Right? And that's going to come through the placenta. I've done a video on placenta. Go to my page. You see the video on placenta. So much to learn there. Right? So it's going to be feeding through the mother's blood via the placenta. And by the way, the mother's blood and the fetal blood does not mix. They don't mix. So that erroneous thought that this is my, people, especially African mothers, that this is my blood in the sense of giving birth to the person. Yes, you are correct, but that your blood directly flows inside the baby, it does not so. The baby's blood came from yolk sac and bone marrow. So it is not from your own blood. Excuse me. I hope that is clear. I hope that is clear. So if it's clear, just type clear on the comment section. Let me be sure you are there. And don't forget to grab people in the viewer's eye. Grab and tag. Connect with people. Let it count. This few minutes you are here. Let it count. Hi, China Zoom Victory. Good to see you. Right? So I was saying that the mother's blood and the baby's blood does not mix. They don't mix. The baby produces blood from yolk sac and bone marrow. So the baby's blood will flow to the placenta. The mother's blood will flow to the placenta and go back. So they'll come closer and they'll go back. So this is what is happening. The mother's blood will bring oxygen, nutrients, necessary um, um, elements for the fetal well-being, and dispatch it into the placenta. The baby's blood will come to the placenta, mop it up, and take it to the baby. While he's doing so, he's releasing excrements. Excrement, not as in poo-poo, right? Waste products that the baby's body is producing into the mother's blood. And the mother will now be peeing for two, excreting for two. Is that not wonderful? Right? So whatever the mother eats, whether it is good or bad, it affects the baby. Years ago, I used to know a lady who smokes weed. She smokes weed heavily, even while she was pregnant. You know, I don't want to call name, because if I call the name now, anytime you see a child with that name, it begins to you begin to think. So this lady smokes terribly. See why your doctor will say no alcohol, no smoking, no drugs, right? Because of your baby. So whatever the mother eats, good or bad, affects the baby. If you don't know before, I'm telling you now. Now, let's talk about important nutrients for early pregnancy. Who is ready? Who is ready for this all important information? Right? Important nutrients. Remember, we are talking about tips on how to support early pregnancy. So, nutrition is one of those important tips. So, I want to give you one or two nutrients that is necessary. Some of you will get it from your supplements, some will get it from your food, some will get it from the antenatal thing you take, right? So the important nutrients in early pregnancy. Yeah. If you are coming up, make sure your mic is muted, please. All right. The first one, every pregnant woman knows this: folic acid. Oh boy. Folic acid. But I want to tell you that folic acid, they are not giving you because they just want you to swallow something that make you squeeze your nose, right? Because it has a way, there's a way it smells. So it's not because they want to give you something that makes you feel funny, right? Folic acid. Folic acid prevents brain and spine defects. Remember, these are the first set of things that begin to form. So these are necessary materials that helps the formation of the fetal brain and spine. Is that okay? Right? It helps prevent. Have you heard of spina bifida before? Spina bifida. Have you heard it before? Yes, there's such thing called spina bifida. I don't have the image. I would have put it on a green screen. Yeah, where there is a defect. The baby is born with a defect of the spinal cord, and you see it all over the place. Right? Yes, like swollen spine. It is what your folic acid is preventing you from, so that you will not come and be crying. How do they call it now? Premium tears, right? You're not come and crying premium tears. Besides spinal bifida, it also prevents brain deformation. So it's going to help you if you will stick to it. Anyway, I'm giving you information. Whatever you do with it is your business. If I met you earlier, I wouldn't have lost my baby. Yeah, exactly. Yeah, you wouldn't have. You wouldn't have. I can guarantee you that. So, but now you're here. Now you're here. How many baby do you want to have in your lifetime? How many? Moving forward, just be having them. You will have them. You will have them. Do not be discouraged. Nothing. If you are a TTC, nothing should discourage you. Who told you that it is a hopeless situation? It's not time for questions yet. Right? It's not time for questions. We'll answer your questions. Okay, so I'm saying that folic acid prevents brain and spinal cord, spinal defects rather. It helps prevent brain deformation, spinal bifida. Let's go to the next nutrient. Iron. Iron. Of course, we all know iron. We know iron. It prevents anemia. Anemia is, simply put, shortage of blood, right? Now, the reason why iron is important is because, please, we are not tapping. Come on, man. I know we are enjoying the gist, but come on, tap for us. Why? Why? Why are we so angry? The more you tap, the more people get to hear the information, and the whole world is a better place. Just imagine everybody who has been crying, looking for a baby. Just imagine by next year, all of them have their babies. Just imagine how happy the world will be. And all they need is just simple information. The miracle they need is in information, right? Oh, you are taking notes. Okay, please. As you are taking notes, also be tapping on your screen. Look for a way to do it, right? Because we want more people to come and take notes. There are people who, have you seen people trying to conceive, having fertility challenge? Some of them is as if they have gone mad. The way they talk, the way they reason, because infertility is no joke. That is why we must help we must help everybody with the relevant information. Of course, there are those who don't like the details that I'm giving, but let them get out. Of what use is your knowledge if you can't share? Does not make any sense. So let's continue. So iron, the iron actually prevents anemia. What iron does is it helps carry oxygen. Remember that the mother, right, is bringing oxygen to the placenta. So, and also other nutrients. So the baby must have iron in its blood to carry that oxygen for circulation. Clear? So that's why iron is a very essential nutrient in early pregnancy. It prevents weakness, dizziness, and also the risk of miscarriage. It prevents the risk of miscarriage. Right? The next one is protein. Protein. Of course, we all know why. We all know why. For growth, for baby growth. Protein for baby growth. It helps forms cells and tissues. They are in their formative stage, so they need a lot of it. Protein, right? Baby growth. Then the next one is calcium. Calcium. Who is asking that question? Choice, go and see your doctor. Go and see your doctor for recommendation, right? The next one is calcium. Calcium. So if you have not followed me yet, this is the time to follow me. Follow me. Follow me. Tap on your screen, share the live. And if you have not dropped a heart me, I want to ask you, why have you not dropped a heart me? Onome Betty is here. So if you have not, why have you not dropped a heart me? And why are you like this? With all this good information, God help us. Right? Thank you very much. Hugo Coro. So we're talking about calcium. Calcium is essential for bones and teeth. It helps the baby's bone to develop. It helps the baby's bone to develop. So you need calcium. Right? The next one. So number what are we? Let me be sure of who has been listening. So the next one will be number what? Let me catch people that are not listening. Today, now today. Who has not been listening? Report yourself now. Report yourself now before we catch you. If you have not been listening, just report yourself. But if you are just joining, don't say anything because you have not heard anything. All right. Number 5. All right. So by the way, I go on live stream 7 p.m. Nigerian time, Mondays to Friday. Right? There are those who are really concerned that, oh, doctor, we need to have you privately and all that. I have a Green App group where I share details of this, all my notes there. You can read and it's going to help you. Right? But again, it's not for free. Thank you. So, but again, if you're in that group, you can always come to my DM for personal consultation anytime in the month, because you have to renew your subscription every 2 months. So we will send you the link to subscribe outside TikTok. Then we'll continue our gist outside. But this information here is as good, it's good enough. But just that in that place, I have you one on one, right? So, okay, just a little correction to Chrissy, just a little correction. Because of what we have done, the link is a flat rate 5K, whatever 5K is in dollars or whatever your currency. The link, everybody is going flat rate 5K, right? So you can use your card, Visa card, MasterCard, regardless. So I'm going to share the link in the green app again. Anybody that taps on it, it leads you straight to where you can subscribe, right? So that's the way. So whatever 5K in Nigerian Naira is in your currency, that's what so it's flat rate. Everybody deserves good information. That's why it's this cheap, right? Omega 3. Omega 3 is the next one. If Dr. Pat is not here, I'm going to be very angry. But boy, if you are not here, I'm going to be very angry. That is the master of supplements. You want to grab her older. Annie Cake said, "Are you a doctor?" I am a bush doctor, right? Right. So, omega 3 for brain development. For brain development, it supports the baby's brain and vision. Yeah. Supports the baby's brain and vision. So these nutrients I just mentioned is going to help greatly. It's going to help greatly in early pregnancy, right? Let's go to the next part of the gist. What you should not eat in your early pregnancy. Remember, I was talking about the lady who smoked weed throughout her pregnancy. Don't be like her. You might not be lucky. The funny thing about pregnancies that are unwanted is that regardless of what you do to eat, it will still come out right. Is that not wonderful? Right? I've noticed that over the years, all those pregnancies, the one that they don't want, they survive all manner of things. They survive drug, smoke, alcohol, all manner of things. They survive. But the ones that they are pampering, oh, help me carry my leg, hold my waist, do like this. A lot of challenges comes with it. All right, that's personal experience anyway. Annie Cake is very simple. Just send a DM either to any of the moderators or myself. We'll send you the subscription link, right? So it's very simple. So what you should not eat in early pregnancy. So what we are discussing tonight is a guide to help you succeed in this your journey to parenthood, especially those that are trying to conceive. Especially, right? Avoid these things as much as you can. Avoid these things. I will not number them. I'll get to a point and I want to know those people that are following me. Because if you're here and you are not paying attention, you lose a lot of information. More likely you misquote me. So I need to pay attention. Pay me your attention, right? So that together we will deliver a good discussion, right? All right, what you should not eat. Oh boy, who is ready for this information? Just tell me in the comment section. Ready, 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 ready. Honorable Betty, good to see you. You're welcome.
Good evening, Dr. Godwin.
Good evening, ma. Good to see you.
Thank you. Thanks for having me.
You're welcome. Okay, so I hope you guys are following. People in the viewers are 50, 49 people. Go grab them, grow your account. I'm not a grow host. I teach health, fertility. But you got to take advantage of this time to grow your account, right? Grab and tag. Grab and tag. Mute your mic. Honey, mute your mic. Mute your mic for now.
Yes,
Mute your mic. As you're coming up, mute your mic.
please, I want to quickly say something. I don't know how to request for the sub because I'm kind of busy now. So I really want to
No,
talk
just
to you
send
one on one.
send a DM. Send a DM. It's okay. Just send a
Okay,
DM.
to
We'll
you
send you the
to you,
link.
right?
Yes, either to me
Okay.
or Chrissy or any of the moderators. But since we are talking now, send it to me.
All right, no problem. I'll just
All right. Okay, where was I? I said avoid these things as much as possible. Number one. Number one, I wanted to say ogogoro. I just remember that I'm speaking to a global audience, so I cannot use that word, right? So if you are not a Nigerian, ogogoro means alcohol. There are different types of alcohol anyway, but ogogoro is the stronger one here in Nigeria. So avoid alcohol. Avoid alcohol, right? Hi, baby soft. Avoid alcohol. Why? Because it causes brain damage. Brain damage, yes. Ogogoro is a local hygiene. All manner of names is just coming up right now. Shakis, right? It causes brain damage. Look at this beautiful thing that is growing here. Why would you want to harm its brain? It does not know anything, right? Number two, cigarettes. All those vapors, cigarettes or vaping. Why? Why should you avoid those things? It's very simple. What it does, it reduces oxygen supply to your baby. No, you cannot look at this picture and not be something don't happen inside you. Why do you want to harm it? Right? Why do you want to harm it? If you smoke, avoid smoking when you're pregnant. Why? Because your smoking is reducing oxygen supply to the baby. Is that okay? Now you know. Repent. Repent. Number what are we now? Now we'll know how many how many people have been following. Mr. Tabs, you'll be shocked. You'll be shocked. Women smoke. And by the way, it's not actually a normal practice in Africa for women to smoke, even though they do. But the society will look at you somehow. I know that in Europe and America, you guys do whatever you like, but don't join them. Don't join them, right? Because you are too much of a custodian of generations to come for you to be destroying your life with these things. Yes, they do. That's why your doctor will advise you no alcohol, no cigar, excessive caffeine. Number three, excessive caffeine, because excessive caffeine increases miscarriage risk. Increases miscarriage risk. Very important. Very important to know. Thank you for the information. Shop with classic. Excessive caffeine increases miscarriage risk. And I was just thinking about these um, executives that are, when you're in that space, it is fashionable to take caffeine, coffee, right? Coffee. Shop with classic. There are several things that can cause it. If you were here 2 months ago, this would have been answered. But don't worry, don't worry. Just keep following. Answers comes every day, so don't worry. The next one, those of you that are mentioning Coke, pizza, that, this, you are in this category. Highly processed food, highly processed food. And these things I just mentioned, they are processed food. Highly processed food. Why? Because of poor nutrients. Why do we have more of these situations today than before with our health, with our pregnancy, or even the baby's health? Why? Because of the kind of food we eat. There are no more nutritious food anymore. No more nutritious food. Poor nutrient content in processed food. But when you are pregnant, you need more nutrients. You need more nutrients. So disease from highly processed food. Right? These things I just mentioned can affect implantation. We talked about implantation before. Your case is shop with classic. Your case is very interesting. Maybe when it's time for question and answer, you come up. Let's hear you. Then, if you need to go back to your doctor, I'll advise you. Or if you want to have a chat with me, then I'll advise you what to do. Right? So these things I just mentioned affect implantation, stops fetal development. Are you listening? Cause early pregnancy loss and cause birth defects. If up to this point you understood anything, just engage in the comment section. Say understood or understand, whatever part, whichever English is correct to you, so that I will know you are there. So the next thing we'll talk about is hydration. All those things I mentioned earlier, I'm trying to give details. So if you have been following, I'm sure you are now putting your points together. All right? Hydration. In fact, hydration is considered a silent protector of pregnancy. Yeah, silent protector. Water is not just for thirst, for your information. Of course, we've done several discussions on water already, right? But this is just to add to the discussion. Water is necessary for formation of amniotic fluid, for blood circulation, for toxin removal, for even placenta development, for nutrient transport to the baby. Water is necessary. Everything we said about water before, add this to it, right? Shop with classic, don't worry, just relax. You come up, we'll have that discussion when it's time. Remember, when we had a discussion about hydration, I told us that we can even calculate how much water is adequate for us according to our weight. And we did the calculation. So, whatever your weight is, multiply by what? Let me be sure who has been following me all these weeks. Whatever your weight is, multiply by what will give you the liters, the volume in liters. Who has been following me? Adequate water with respect to your weight. Your weight multiplied by what to give you the volume in liters. If nobody knows this one, of all this teaching, I will stop coming on live stream. I will use my time to go and sleep. All right, so whenever you remember, whenever you remember that weight, you will need to adjust that liter, sorry. But basically, pregnant women will need 2.5 to 3.5 liters, depending on what their weight is. And also adjusted for the climatic condition where you are. I understand it's winter in Europe right now, right? I understand it's winter. So it's pretty cold. You may not necessarily need as much water as those of us in temperate region like sub-Saharan Africa. So you want to adjust that quantity of water according to your climatic condition and your your body demand. For example, those in a sedentary workspace versus those doing mania physical activity kind of job. So you want to adjust it and take adequate amount of water. But the basis is your weight multiply by 35. Your weight divide multiply by 35, convert to liters will give you the 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 adequate volume for you. Remember to adjust it according to your climate, your body, your activity, and and other issues, right? So, what are the signs of dehydration? Who said come again? Abimbola, you are looking for trouble. Signs of dehydration. How do you know? This early pregnant woman, how do you know? Possibly, this is dehydration. These signs can be seen in other things also. However, it's an intersection, right? So, generally speaking, you have dark urine, even when you're not pregnant. You don't take enough water, you have dark urine, right? So you have dark urine. Your urine is getting dark, it means that you are dehydrated. You need water. Headache. Headache. Headache is a type of pain that signals that something is wrong, right? Headache. Dry lips. You see, dry lips is like one of the most physical things to see. You know that this person is dehydrated, right? Dizziness. Dizziness. Constipation. Now, if you see these signs, increase your water intake. However, go and see your doctor. These are the things you can do to help yourself while you go and see your doctor to help you holistically. Is that okay? And we must come back again to the issue of rest and sleep. I've talked about rest and sleep. It's almost becoming an anthem, right? Remember your body, besides the sleep and rest your body needs for you. Now a new life is formed. A new human being's body is being formed. So you need rest. You need sleep for this new human being. Right? So like, how do they used to say it? They say whatever you do, you're doing for two. Right? Whatever you do for two. Many women feel tired in early pregnancy. But this is normal and necessary. This is normal and necessary. That tiredness is normal. Why? Because your body is making a new life. Placenta is being formed. Your, your blood volume increases. Right? Hormones are rising and falling according to their needs. Right? Like the three I mentioned when we started. All that is just to support this embryo, this new life. That is why you need the rest, you need the sleep. One of the things you should aim for, remember our 7 to 8 hours sleep. Ninth time, enjoy your nighttime sleep. If for any reason your occupation does not allow you to sleep at night, make sure you are taking enough of it in the daytime. Don't close from night shifts, then go all over the place doing everything else, only to go and resume back night shift. You are not helping yourself, and I can guarantee you are not helping your pregnancy. You are not. Charity baby, I see you. Right? 7 to 8 hours of sleep, especially at night time. Because you are pregnant, you should also thank you very much, Omawumi. Thank you for the heart. Because you are pregnant, you should also grab some rest. Take some rest, some nap, if you are tired. You cannot solve the whole problems in one day. You know that some people, when they are pregnant, they can look for broom and sweep from North Africa down to South Africa and back again, all because they are pregnant. Like they'll say, they can sweep for Africa. You also want to make sure your hello, Charity, mute your mic for now. Mute your mic for now. Wendy Royalty is here. So even though I know that you want to do some work, please reduce. You want to do less of work, and also especially reduce heavy manual labor, right? In that your early pregnancy, adjust your work pattern because we need this. We need enough rest for this baby to be formed. Lack of sleep will increase stress hormone, cortisol. Remember that hormone. I've talked about cortisol several times. Lack of sleep. Our husband should allow us rest. Well, it depends on the direction. Okay, okay, okay. Thank you very much. Thank you very much. Thank you very much. You are welcome. Right? Remember cortisol. So I was going to say something. Yeah, she said our husband should also let us rest. Depend on the rest you're talking about, right? But in early pregnancy, I know that there are some people who you you don't want to take it easy in the other room. You don't want to take it easy. Please take it easy. It's your early pregnancy, right? Take it easy. You can continue as you progress, but this early stage, take it easy, right? Is that okay? Okay. So let me just say that before I forget. So stress hormone, right? Lack of sleep will increase your BP. Lack of sleep will increase fatigue and weakness. You don't want to do this to yourself. Even if you want to do it to yourself, don't do it to the baby. Thank you. Aristola is here. I see you. Good to see you. You're welcome. You see, stress. Stress is the hidden danger in early pregnancy. The hidden danger in early pregnancy is stress. Because of that same, remember that hormone, cortisol? It's not a good one. But if you are stressed, that hormone will increase in your system, right? So high cortisol level means your stress is increased, right? Uh-huh. And increased cortisol will reduce blood flow to the uterus. Somebody help me say increase cortisol. In other words, increase stress. Increased stress will reduce blood flow to the uterus. Yeah, it can affect. Hi, hi. Your name has a lot of emoji, but I see you. Good to see you. You're welcome. Good evening. You're welcome. Right. So high cortisol equal to high stress will reduce blood flow to the uterus, will affect implantation, will trigger contraction. Where is that my friend I was talking about? Something with classic. I can't remember now. Shop with classic. Are you still here? So you want to check your boxes. Which one is really the problem? I Joke. I'm fine today. I'm fine, thank you. All right. So where was I? Achieve as I see you. So increased stress or high stress will reduce blood flow to the uterus, affect implantation, trigger contraction, weaken the placenta. Where does stress come from? Like my lovely Loisa said, our husbands should. Okay, okay. I'll check it out. I'll check it out later. Loisa said, this is Loisa that said it, I can't remember. Loisa said our husband should also allow us to rest. So this is where stress will come from, right? Relationship problems. And I've always talked about this on the live stream. Really, you see this fighting. You are a couple now. The reason why you are a couple is because you agreed to marry. You were friends. You became lovers. Now you want to start a family. So why this fighting, quarreling, acrimony, disharmony? Why? Why? And now you are pregnant. Do you think that behavior will support the pregnancy? For those that are Christians, the Bible said, seek peace with all men. So regardless of what happens, if not for yourself, I know your blood is hot, right? Your blood is hot like fire. Seek peace with all men. At least for your baby's sake. Seek peace with all men. No fighting. You're already a couple. Alright? I know infertility can cause a lot of strain in relationship, but look for a way to manage it. You cannot be fighting and yet you are trying to conceive. It's a no-brainer. I can't understand. I can't understand. Don't you know that emotional shifts can make even the vagina acidic and it will destroy all the sperm cells? You don't know that? You are fighting with somebody that you are knocking. I don't understand that kind of fight. Somebody should explain it. Somebody should explain that kind of fight to me. You fight and knock and fight and knock and fight. I don't understand. You causing confusion. It is you that needs this miracle. But you need to play your part. Seek peace. Maybe after you deliver your baby, you can go and do Jimmy so your muscles come out for decking. It's okay. But now we have a baby that is in the farming. You don't want to do all that. Relationship problems, right? Relationship problems. You know, I tell people I used to have a girlfriend years ago. I hope she's not in the FYP listening to me. We are no longer, But every month we break up, fight, agree, quarrel. Why? Because women get am for body. Right? I thank you. Is that not Nurse Princess just said it? Pepper body day. Right? Every month. Because of now women hello, mute your mic, you're welcome. Every month women go through a cyclical hormonal changes, right? And that also causes mood swing, change in the way they they behave, right? Some their own is onto the extreme, some in the middle, some in the other extreme, right? So for those that are in the extreme, I've witnessed that before. Every month you have to break up now. Because if you give me bars, I'll give you both. I need to pay too much. So so when that phase of the hormone pass, then it's time for ovulation. Become all lovey-dovey, oh sorry, and all that. For how long will that going to happen? Stop fighting. Okay, Abimbola, have you sent me a DM? Please send me a DM, please. So that I will not forget. Please send me a DM now like this. Right? Right? So you are increasing your stress level when there is so much fighting in your relationship. And I told you it's going to affect a lot of things. So where is stress coming from? Relationship problems. Then another area, oh my God. This one you can almost not help it. Another area is financial worries, finances. It affects everybody, regardless of whether you already have, already you are comfortable or you are not comfortable. Financial worries. That can bring stress. But the reason I'm saying this is so that you can determine where your problem is coming. Please ask your can you ask your matron? Can you ask your matron? I'm talking to Mandudlo, right? Please ask your matron. So where was I? So relationship problems can cause stress, financial worries can cause stress, even the fear of miscarriage. I've never seen among human beings the set of people that can be so afraid more than pregnant women. Women can be these pregnant women can be afraid for nothing, nothing for no reason. Sometimes they'll come to the hospital like this. They're already afraid. What? Everything is alright. Good evening, Sugar Love. If you have not followed me, please, this is the time to follow me. Please, let's take this likes before the end of this live stream. Let's hit 100 plus, right? Anxiety for nothing. Nothing is wrong. You're just afraid for what? Because she's pregnant now. I understand, but please, can you reduce that stress? Because you can terminate this pregnancy with this your nonsense fear where they take the disturb us, right? Then there are those who have stress due to the kind of work they do. I met a very lovely lady today, and I was asking. She was telling me a lot of stuff, so I was asking, "What do you do? What do you do? What do you do?" So even some sit-at-home moms do a lot of stressful things too. This, that's when that's when somebody will remember that they need to tear down the roof, wash all the roof, and put it back before everybody comes back. Yeah, Dr. Path, it's true. Pregnant women, from experience, I've been told, they have all manner of dreams. I don't know whether it's the figment of their imagination or is specific to certain people. I don't know. Someone will say, "Oh, when I was sleeping, some people was pursuing me." Some will say, "When I was sleeping, I saw snake." When I was sleeping, somebody was taking my baby. All manner of dreams. All is a question of anxiety and fear. Please manage your fears, right? Manage your fears. But how do you even manage your stress anyway? You can manage your stress through walking. Just take time, walk around your estate, your environment. It refreshes you. right? Um, for those of you that are religious, pray, right? Spend quality time, pray. I know. Ezinwa, I know. Yeah, you can have, like yesterday we were doing Christmas carol, right? And we were having some beautiful song. So you can use music to help yourself, right? Also talk to trusted friends. Like those of you that are subscribed to me, I told you, you have me throughout the month, anytime you want. Send me a message on the DM. I will respond to you within 12 to 24 hours. If I'm not busy, I'll respond to you. So talk to a trusted friend. Talk to a trusted friend, right? Do breathing exercise and also stay away from negative news. Today you hear 16 people killed in Australia because there was a shootout. Tomorrow you hear um, Nigeria, 7,000 people killed in 1 year. And then the other day you hear coup d'etat in Benin Republic. Another day you hear Gaza Strip war. So remove yourself from those things. Purify your mind with good information. That's how to deal with stress, right? Because a peaceful mind creates a safe womb. If you didn't hear anything I've said today, this statement, don't forget it. A peaceful mind creates a safe womb. That's why I beg you, stop fighting. That fighting, acrimony, this harmony in your relationship, stop it. Right? Stop it. So, what for those of you that wants to do exercise, gentle movement is better than the hard exercise you have planned for. Please be careful. Slow walking, stretching. Um, um, some people do yoga, but do the one that is pregnancy safe, right? Even moving around the house will help you. Don't that your first trimester lifting unlike those days when our mothers were equipped for these things. Now I can guarantee you that when I was in my mother's womb, my mom would go to the farm, do all the farm work, right? Go and cut down a huge log of firewood, put it on her head, take it to the house, split it up, cook food, pound yam, and the whole family will enjoy. And here I am. I'm here today, right? Hail, hearty, and strong. You don't want to try that today because you are not equipped nutritionally, physically, and otherwise. Don't, don't try it. Don't go and be doing heavy weightlifting. Don't go and be doing jumping. I don't know where you're jumping to. Don't go and be doing hard workouts, right? Or even long distance running, please. Please save our pregnancy. The whole idea of exercise is to support blood flow, and blood flow is necessary for nutrition, oxygen, and proper circulation of nutrients, right? All right, so let's take questions. Let's take questions from, please, everybody. There's no criteria for coming up to in the whole of December. So everybody send your request. Come up, ask your question. When you're coming up, make sure you mute your mic. Ask your question. Then let's tackle it before we go. We have 30 minutes to finish up, right? But while we are waiting for questions, I want to give us warning signs that you must never ignore in your early pregnancy. Warning signs: vaginal bleeding. What did I say? Warning signs that you must never ignore in your early pregnancy. Vaginal bleeding, abdominal pain, abdominal pain. I know people vomit, but when the vomiting is severe, don't ignore it. Fever, fainting or dizziness, right? Bad smelling discharge. Please, if any of this applies to you, go and see your doctor. Quickly, quickly, please. All right, so who is asking questions? Please come up and ask questions. Good evening, Lisa. I don't understand your question. Vicky is here. Loisa, go ahead. Talk to me.
Good evening once again. Thank you for the opportunity, Doc.
Good evening, you're welcome.
My first question is during the lectures, you made us know that during pregnancy, there is no exchange of blood. Why then is it that
Yes.
when a woman is HIV positive and she's not on treatment, the baby can equally be HIV positive? And then the second question is um a mother with an autoimmune condition, is it possible that the baby can also have a condition like that?
No, if it's genetic, yes, but not necessarily so. So
Okay.
to your first question, most of the HIV infection that happens during delivery, because there is such thing as safe delivery for HIV. Thank you very much, Vicky. Right? There's such thing as safe delivery for HIV positive mothers. That is why these are the things that are tested. Do you understand? So when a woman is already confirmed to be HIV positive, what happens is, of course, she's placed on her drugs and all that to suppress and to reduce the viral load, which is better for her, right? Then when it's time to deliver, there's safe delivery. Most of the contamination that happens at the point of delivery, not while the baby is in the womb. Do you understand?
Yes, please.
Does that worry you in any way?
No, please. No, please.
Okay, I hope it's clear.
Yes, please. And Doc, please, finally, assuming a lady is 40 years old and she's not married, the reason being that probably relationship challenges or and she has no child.
No,
So
hold on,
and,
hold on.
so she's
Reason
concerned.
being that,
Probably she's just not married and she's 40 years old.
okay, okay.
Yeah, the reasons are numerous, but she's not married and she's 40 years old.
Mm.
Uh-huh. So we learned earlier on that as you grow, your chances of getting pregnancy reduces. So some do advise that if that's the case, then she should go and then remove part of her ovaries and then thaw down for future reasons. What is your advice to that? He's not married and I don't know how to say that. No, please. I hope you're okay. She
I
can't get
like your
pregnant
question.
until the right thing is done before until she get married, she can't get pregnant. And she's
I
growing
like your
old.
question. I like your question. First of all, there is no law that says that until you get married before you become pregnant. There are lots of people who there are lots of people who, who are pregnant and even removing the pregnancy and they are not married. Right? So there's no law. That's number one. Now this is my own opinion. It's not a play. This has nothing to do with medical anything. It's my personal opinion. That's number one. Number two, there are several reasons why people don't get married, right? For many of them, no, a few of them is choice. But if you
Yeah.
have that choice, but you want to still have children, as at when did you make up your mind that you don't want to marry and you want to have children? As at when? Now, if having kids is part of your plan in this world, Famal Ambassador is here. If having kids in this world is part of your plan, my personal advice, start early, best in your 20s. Why? Why? Because by the time you get to 30, fertility begins to decline. 35, it becomes worse and lesser chances from 40 and above. Even with assisted reproductive technology. Why? Because you see, women don't produce eggs like men do, like men produce sperm. Every woman is born with all the eggs that we ever have in this world. It was follow come, you were born with it. So it's not as if as you are growing, you are producing eggs. No, the eggs are already there. Somewhere around 1 million to 2 million, right? Basically. Now, by the time you get to puberty, 1/3 of that egg is lost. By what means, I don't know, but it's lost. Then the remaining 2/3 will continue to deplete in a geometric form up until you hit your 30s. What do I mean geometric? By the time for every month, due to the influence of your hormones, anywhere from 4 to 8 eggs begins to follicles actually, but I want to use eggs for general understanding. 4 to 8 begins to develop, right? Of the 8, let's use 8 generally. Of the 8, 1 will dominate and ovulate. What happens to the remaining 7? They don't go back into the store. They degenerate and pass away. That is minus the 2/3, minus from the 2/3. So you can see the geometric decline of age as women grow older. Now, why did it get worse at 35 years of age? Now, I'm not saying this to scare ladies. I'm only saying that it's best to start a family when you are young. That's what I'm trying to say. But if you are not If you are already in your 35 and above, I told you before, make me your best friend. I will give you the correct advice that can help you. Anyway, why did it get worse from 35 and above? Is because besides the depleting number of eggs, the quality of the egg due to chromosomal fragmentation also becomes a factor. That's why there is higher chances of miscarriage among older couples or older women than there are in younger women. Do you understand what I'm saying? Hello, are you
Yes,
there?
please. Yes, please.
Okay. So by the time you hit 40, depletion is more, quality of egg less. And I tell people, especially those that are going for assisted reproductive technology, I tell them, please, I know you want to use your eggs, especially those of us in Africa. We like our own thing. I love Africans. We're wonderful. We're wonderful. Thank you, Mpafani. Thank you. Right? So we want our own thing. So they say, no, doctor, I want to use my egg. I want to use my egg. It's okay. But it will be smart for you to have a plan B of donor eggs. Why? Because most donor eggs are from younger individuals, especially in their 20s. So you have a higher chance of success with those eggs than the eggs that comes from somebody who is older. So you can see the concern. And that's why I said the only barrier here is knowledge. After today, I know somebody has learned something that they will apply. Do you understand? So thank you for that. A very important question you asked.
Thank you very much. God bless you.
Is that all the question you have?
Stuck. Let me give room
All right.
for the others. Thank
All
you.
right. So, yeah, you're welcome. You're welcome. Abimbola, Abimbola, what stage of pregnancy are you? Of course, when you already have a baby born, you know that you are sleeping by your side. I hope you know. That's why you should attend antenatal. I dey suspect you. Abimbola, I dey suspect you. You know they agree attend antenatal care. Why? Tell me why. Why don't you like antenatal care? Hmm? You are 4 weeks. Okay. Okay. It's all right. But just make sure you you do all the right things. But the earlier the better anyway. The earlier the better. All right. So who has a question? If there's no question, in 20 minutes time, we will go.